So let's say you're someone who has knee issues. You have arthritis or you've had surgery, and you've tried all the different squatting types of things, but they continue to cause you pain, right? So that's where something like ankle weights could come in handy. I'm just going to show you how to do your basic straight leg raise properly, because most of the time the way I see it instructed, or when I see a patient demo it, it's useless, right? But it is a good exercise if it's done correctly. So so this is like an adjustable pair of ankle weights. You could adjust it from 1 to 5 pounds, right? Right. So what you want is to first roll up a towel and stick it under the knee, right? So you can just start by pushing your knee down into the towel. And what you're gonna try to feel is the contraction of the quadricep muscle, right? So if you push down, you feel it squeeze. In particular, pay attention to the inner part of the muscle and give it some tapping, right? Some biofeedback to get the muscle fibers to contract more efficiently, right? And then relax after about 10 or 15 seconds. So you'll do that a few times where you squeeze it, get that muscle to contract as hard as you can. Right. So the next thing you could do would be to flex your foot, right, by lengthening the Achilles tendon, right, lengthening the heel at the same time that you push into the towel. And what you'll feel is, as you engage the foot, is that you start to get a stronger contraction. So the whole goal of these exercises, is to create tension, right? So the more tension you create, the better the recruitment of the motor neurons that innervate the muscles. And, over time, your brain becomes more efficient at recruiting these muscle fibers, right? So that's what's going to give you strength, right? So most of the time, people are basically, in most settings, those of us who are training for strength are training the nervous system. Not many of us are out there developing muscle hypertrophy, right? That requires more intensive training and a lot of attention to nutrition, right? Right. So I'm just going to lie down and go ahead and go into the leg raise. So what I'll do is first do this quad set, right, where I set the quadricep muscle, then I flex. Everything is maximally contracted, right? So then I lift up, and no higher than about here. Certainly no higher than the knee, because it just it takes the load off of the quadricep muscle. So you want to keep it maybe to a foot or two, and then squeeze that muscle as hard as you can. Make sure it doesn't feel like it's going into the hip flexor muscle. Focus your attention there, right? And then just let it relax. 2 or 3 seconds. Start again. Push down. Tight, tight, tight. As tight as you can get the muscle. Lift, keeping it as tight as you can. Engage your core a little bit. And then come down. Right. Some people will say turn the leg a little bit to the outside, right? But that it doesn't actually increase the muscle activation of this VMO portion of the quadricep. It'll get you a little more the inner thigh. I don't have a problem if a person does it, but I want people to focus their attention on the quadricep when they do the exercise. So if you do a couple sets of these, 8 or 10 reps, that can be pretty useful, for maintaining the quadricep strength, right? Because you need a certain degree of quadricep strength for walking, general mobility, because it helps with the stability of the knee.